Welcome to Atrium Health, Navicent Knows Health. I'm here today with Dr. Art McCain. He's board certified interventional radiologist, and today we're going to talk about his treatment using radio frequency here in Central Georgia. Dr. McCain, thanks so much for being with me.
Yes.
Would you tell the audience first, what is radio frequency? What is the technology?
Radio frequency is exactly what's produced by a radio station that you listen to on your car radio. Mm-hmm. It's exactly the same thing produced by a TV station that you watch television on. Mm-hmm. But it goes all the way from those to even higher frequencies, the frequency part of the radio frequency, to medical uses, which is what I'm discussing today as far as the expertise of the interventional radiologist using radio frequency in treating diseases.
Mm-hmm. So when we think about traditional radiology, we think about the modalities like X-ray, MRI, and so forth. But you're talking about treatment using radio frequency to treat diseases versus the diagnostic side?
No, both diagnosis and treatment. Mm-hmm. Yes, as a radiologist in my specialty, I'm an expert in using radiation to make diagnoses, but radio frequency is also one of our expertise, and an MRI machine is actually a big radio transmitter. Mm-hmm. That's exactly what it is. You think of it being a magnet, but it's really a radio transmitter, and it has built-in antennas to receive the signals from your body, which then produces the images that we use to make a diagnosis with. So we use radio frequency every day in making diagnoses.
And tell me about the safety of radio frequency as a technology. It's something that you said we've been exposed to from radios and televisions, and it's also used in medicine?
It's totally safe, in that we have radio waves going through us all the time. Mm-hmm. And what we do in medicine is we take the radio frequency and focus it in tiny catheters or needles to use it exactly, and we can calculate the exact amount of tissue that we're treating, and it heats the tissue up and burns it and treats the disease. Mm-hmm.
So let's shift gears to what kinds of conditions you're using radio frequency for. So I know that some of them are in the office things that you do, and some of them are in the OR that you do. So tell us a little bit about those.
Yes, in the office we use it to treat vein disease, and it's versus the old-timey stripping, which was really medieval. But with this, we can stick a little tiny catheter with a radio frequency transmitter in it, put it inside the vein, and we put local anesthetic around the vein so that you don't feel the heat, but it actually will heat up the vein and make it go away. And that's essentially using radio frequency waves, just like what you're listening to on your radio.
And that person who maybe has the vein that they want changed or use radio frequency on, they're referring themselves. So if I have a large varicose vein and I see it, I come to your office, and then you determine whether or not it can be helped by that.
Yes, they come directly to see us to treat the vein disease.
So tell me about the other treatments that are more around cancer and other things you might do in a larger, like in an OR.
Well, actually, in between, there's another area that we treat as well, is back pain disease. We can treat nerves causing some of the back pain that you have, and the same thing, we'll stick the needle right next to the nerve, use the radio frequency to burn the nerve, make it go away, and then your brain quits getting the signals of pain from that area, usually lasting for well over a year. The nerve will eventually grow back, but then we can repeat the procedure and treat the pain again for about a year. And it's for the patients who are candidates for it, for a minor procedure, placing a needle in there, that's a great way to treat back pain and keep it under control.
Tell me about the back pain, the source of that particular back pain. Are those what consumers might think of as they have a herniated disc, or they have an irritated nerve, or what kind of back pain? What's the diagnosis of that back pain source that are coming to you for that?
It's not the disc pain. That's the part that mostly needs the surgery or injections with steroids. But what we're talking about is the facet, which is a joint. It's a joint just like in your fingers, and it's become arthritic and is producing pain, just like you have the arthritis in your hands or your wrist. It produces arthritis in your back, which is incapacitating to some people, and so we're able to take it, get rid of those nerves, and make their life tolerable.
I see. Okay, so then tell me then about the sort of the larger component of it then, which would be oncology or cancer surgeries.
Yeah, so then we have the procedures that we perform in the hospital using the CT to guide placement of our radiofrequency probes, which is a needle. We actually call them antennas, but if you looked at it, it would just look like it was a needle, but it's an antenna. And we place it into the tumor using the CT guidance. One of the more common procedures I perform is treating renal cancer with this needle, and we'll take it and guide it right into the renal cancer. Again, using the physics calculations, we can calculate exactly how much tissue we're going to get rid of, run it for the appropriate amount of time to do that, and take it out. The same thing when you have cancer that has spread to the spine or to other bones, metastatic disease to the bones causing lots of pain. We can take these needles and stick it in there. And in the spine, many times it's associated with a compression fracture, which we get rid of the tumor with the radiofrequency, and then we'll stabilize it with the kyphoplasty, where you put the cement in, like putting a cast on the inside of the bone.
And you talked about the nerve in the spine for the back pain eventually regrowing.
Yes.
When you ablate or use radiofrequency on renal tumors, do they come back, or is that a final treatment for that?
In some cases they can come back for a couple of reasons. One, perhaps when we burn it away, we didn't get the entire thing. This is very rare because, like I said, we're able to calculate the exact amount of tissue that we get rid of. The other thing is some patients who have renal tumors will have a tendency to form another one. So I'll have some patients, I'll treat it in one kidney, and then a few years later they come and they have one in the other kidney. So I'll treat that too. So once these are treated, we continue to monitor them with MRI, which, as we mentioned, is another radiofrequency device.
So tell me, what do you think? We've talked about doing veins and back pain with it, and renal tumors or other. What are the future uses of this that you see? Are you already seeing other ways it can be used, even than what you're doing today?
Well, as I mentioned, the one is doing the metastatic disease to other bony structures. That is really, that's the cutting edge part of using the radiofrequency right now. I've been using it in the spine to treat spine disease for many years. And now, I mean, our big society is having their meeting next week, and the big subject is treating metastatic, where tumor has spread to other places in your bones, and using this procedure to treat the pain coming from those and getting rid of the pain. So that's the cutting edge right now.
So you talk about the idea that you can micro-target, so you're tissue sparing. What's the return to work? I can guess, as compared to the larger surgery, but what is the return to work like post radiofrequency?
Well, when you do the radiofrequency with a vein disease, I've had patients go back to work that afternoon. When we treat the kidneys, they can go back to work the next day. I mean, you have a little nick on your skin. That's it. You don't even have a stitch. You don't have enough of anything to get any sympathy from your family.
Which isn't bad.
But yes, so they go back to work. Now the spine patients, they probably would be a couple of weeks after it, because with the tumor to the spine, you have the compression fracture, and so we stabilize it, but then we're working with the patients to get rid of the rest of the pain in conjunction with the radiation therapy that will treat some of the residual. There's a lot of reasons when cancer can cause pain. So it's a combined effort with the oncology, radiation therapy, and us, and treating the pain. So that can take a little bit longer.
And that was going to be my question. I'm guessing you're working in consult with, in the case of the renal tumors, the urologist.
Yes.
If they're cancerous, you're doing that treatment, plus you may have a radiation or a chemotherapy team that's working with that patient.
Yes, it's a combined effort.
Well, if a patient who's watching today, or a consumer, and they recognize some of this in themselves, or they know they have a condition that might benefit from this treatment, how do they get in touch with you? What's the path to getting to the radiofrequency treatment?
To come, so we see everybody in our office at Vira, V-I-R-A, and we'll consult the patients before the procedure, tell them the alternatives, the risks, the benefits, and then after the procedure, we follow them up too in our office. And
if they are experiencing this and they want to tell their doctor, they can just say that, I'd like to see Dr. McCain.
Yeah, ask their doctor if they might be a candidate for this procedure to help them, and have them refer them to our office.
Okay, well, thank you for telling us so much about your practice. Thank
Sure.
you. And thank you for watching us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. McCain and his practice, please visit us at atriumhealthnavicent.org.